Hi, everyone. Hope you guys are having a great day. I'm really excited to have Dr. Bana Kashani on again. She's a fertility doctor in Orange County. Hi, Jamie. Hi, Judy. So it's awesome seeing everyone join us today at 4 o'clock. Obviously, it's 4 o'clock. And we're going to do a live Q&A once again. Hi, Jamie. Hi, Ellie. Love seeing all these people joining us. Thank you guys for joining. Hi, honey. There she is. Okay, I'm going to invite her right now. Here we go. We're waiting for her. Wait for it. Wait for it. Hi, how are you? How's everything going in Orange County?
It is good. It's good.
Okay.
How about you?
Everything's great here. So everyone, this is Dr. Bana Kashani. So why don't you just tell our audience members more about yourself, where they can find you as a doctor, and we'll get right into the questions.
Sure. So my name is Bana Kashani, and I'm a reproductive endocrinology and infertility specialist here at Eden Centers for Advanced Fertility in Orange County, specifically Newport Beach in Southern California. So awesome. You can find me at Dr. Bana Kashani on Instagram.
Perfect. Yep. I want you guys to follow her, and then we'll have her on again. So you were on last week talking about fibroids and fertility. If you guys haven't watched that show, please go to YouTube. You'll find it there. You can also find it on my IG Live as well. Okay, so we got a whole bunch of questions, and one of the questions, I'm going to read it right here, is, here we go. My fertility doctor told us that alcohol does not affect sperm. What's the real deal?
You know, I think it depends on the situation and circumstance. I do think that small amounts of alcohol in moderation are appropriate. Obviously, binge drinking, there have been some studies that show that it can definitely impact sperm quality and potentially numbers. So as everything in life, everything in moderation. So 1 to 2 glasses of wine are probably appropriate, but beyond that, you should tone it down while you're trying.
I just tell people, don't get your sperm drunk, right? I mean, this egg retrieval is the most important part of your life. That ovulation is your time to shine. Yeah. So drunk sperm don't know how to find eggs that easily.
Absolutely. I love that.
Yes, it's true. Okay. So this is a question that we got. Someone posted it as a comment in today's, when I posted about today's Q&A. And so I'll read it. It's a little bit long, but I think, give me a chance. Okay, here we go. Here we go. Let's see if I do a good job here. Okay, I'm 40 years old. I've been trying to conceive naturally around 6 months, but my doctor told me that the only way I can get pregnant is IVF because I have endometriosis and a 25 millimeter cyst in my left ovary. What do you think? Do I have any chance of conceiving naturally?
So there's always a chance to conceive naturally. Absolutely. We never say 0% chance, but it's a matter of understanding the situation and picture. Being 40 with endometriosis, unfortunately, makes it really challenging to get pregnant naturally. I'd probably say less than 5% chance per month. And so I think your doctor is telling you that because they just want to help you get pregnant earlier. Time is of the essence when you're over 40. So yes, IVF would get you there much closer. Unfortunately, you've already been trying for 6 months. If you try for another 6 months, a year, and you're 41, your chances of IVF success even go down. So that's the best. My recommendation would be to do the same, but there's always a possibility of getting pregnant naturally.
Perfect. Next question is, I get lots of questions about ovulation and discharge. I'm sure you do too, but this is a discharge question. My ovulation discharge is watery. What do you advise for me?
Yeah, well, it depends on when in the cycle. If your ovulation or discharge is watery after your period is ended and a few days prior to expected ovulation, that's actually a great thing. That probably indicates that the egg is growing, getting mature, and making estrogen, and that's what estrogen can do. Now, you should see a shift in that, and it doesn't happen in all women because all of us are different, but if you then see it go from being watery to that egg white discharge, then I think that can really clearly tell you probably are ovulating.
Great. Next question. How do you know your hormones are in balance?
Oh, such a good question. Go see a fertility specialist. No, I mean, one of the biggest ways you can tell is simply watching your menstrual cycles and tracking them. the body's hormones are usually in balance if you are getting regular periods, right? That's one vital sign that's so critical and so important. If anything seems off, then it's very simple blood work to get done. And it's important, again, to see a fertility specialist, because some people order labs, and if they're not done at the appropriate time within the cycle, then unfortunately it can be not interpretable, or you can get the incorrect results. So that's why I think it's really important to see someone and just get them checked.
Absolutely. I've had patients who, let's say, have an estradiol drawn on day 3, and let's say the level is less than 20, and then their OB/GYN tells them they're in menopause. And then they're freaking out because obviously they want to have a baby,
and we're like, no, that's normal.
And exactly. But they've been convinced that they're in menopause, so it's hard to convince them otherwise. But we have ways of doing that. Okay, here's another question. I'm 42 years old. I've done 3 IVF cycles. I didn't even get 1 egg to work. Should I do another cycle or consider other options?
That's a really tough one, and I'm sorry to have, someone go through that. I think the decision, it really is a personal decision. After having done 3 cycles, it's maybe worthwhile to consider either a second opinion first. Maybe you need to switch centers or try a different protocol if you're absolutely set on using your own eggs. If not, in pregnancies, all you dream about and that you want it to be there quicker than ever, then donor eggs are probably going to be your best chance of success. Donor egg IVF can get you a chance of success of over 50% at times. So that's what I would consider.
Okay, so here's another great question. Is an estradiol under 20 okay cycle day 1 through 4? And what is the range that we're supposed to see around cycle day 3?
I think an estradiol less than 20 can be completely appropriate, as long as, we're not also seeing other hormones that are all on the very low end. But a range of about, 20 to 50 or 60 is what I would consider normal. Estradiol level that's really over 50 or 60 especially, to me sometimes can be an early sign of diminished ovarian reserve or a decline in egg number. But that can happen some cycles and be normal. So it's, again, important to piece together the whole picture and get the full history as well. So,
And there are some labs, for example, that below 50, they actually don't report it. So there's a big hospital center around here. They just report their estradiol as under 50.
Oh,
so they don't tell you if it's like 30. I mean, it's okay, but when you see that less than 50, patients sometimes think that there might be some sort of abnormality when there actually really isn't an abnormality. Okay, so this is a tough one, and it's a sad story, but I'm going to share it real quickly. So I'm 40 years old. I've had 5 miscarriages within 3 years. What are my chances of having a healthy baby?
Well, one thing that I always tell people is, thankfully there is the ability to get pregnant. You ovulated their sperm, the sperm and egg met. Unfortunately, it didn't take, and you really, really have to do a detailed, thorough evaluation to figure out why. Just based on an assumption of age, a lot of times conceptions take place, but it's a genetic abnormality. So I think that the best thing to do is you can absolutely get pregnant again. The chances could be good, but I would consider doing IVF with pre-implantation genetic testing, because if you do get a viable normal embryo that's genetically normal and you get pregnant with that, then the chances of miscarriage are significantly reduced. It's not 0, unfortunately, but it is reduced. So it could be, a very good possibility that will result in a full pregnancy and delivery.
Perfect. So here's another question. I'm 30 years old. My AMH is 0.53, FSH is 13 while I was taking Vitex. What are my chances of getting pregnant naturally?
So a single AMH, low AMH, does not necessarily indicate infertility or an inability to get pregnant naturally. There's actually been one really great study looking at this. But if you have infertility and your AMH is low and you've been trying for a while, then the chances are probably low. So if you've been trying for a year and your AMH is 0.5, then the chances of natural conception are going to be about less than 3% per month potentially. So in those circumstances, things like IVF and embryo banking can be exceedingly helpful to help you achieve a pregnancy faster and preserve the opportunity for not just one child, but maybe a couple of children in the future.
Perfect. Every month I get a period, but I don't see a positive OPK. Why?
You're probably missing it. There is rare circumstances where people get periods, but they're not truly ovulatory. But a lot of times OPKs don't work for people. And if you don't, if your urine is diluted or you're not checking at the right time of the day, or sometimes you need to check twice a day, you could miss it. So, the best other thing that could be done to just confirm ovulation if you're still not getting a positive OPK is maybe 7 days after expected ovulation, you can get a progesterone level, a blood test done. And very clearly, if the number is elevated, that can indicate that you surely did ovulate. You probably just didn't pick it up on the OPK.
I agree. Yeah, I mean, they're extremely inaccurate and they're frustrating because you can sometimes see a trend toward positivity and then it goes away. And then people are like, I didn't ovulate, rather than saying, oh, I might have ovulated in that window of time. Okay, this is not something I'm going to read out loud. This is a question we got, but I'll just keep that one to myself.
Oh,
okay.
Wow. Okay.
Yeah. Might be X-rated. Okay. What would you advise a patient who's suffering from PCOS and fibroids to conceive?
PCOS and fibroids.
And fibroids. Mm-hmm.
Okay, well, first of all, you need to have a detailed evaluation as to where the fibroids are located, okay? Depending on their location, it could be okay to proceed with conceiving, or you may require surgical removal of the fibroids, again, depending on their location and size. If you have PCOS, you have to consider your age and other factors. A lot of times, if it's a simple problem of ovulation, you can take a medication to help you ovulate and try to get pregnant naturally. If you are older, though, on 40 and you have fibroids and PCOS, then maybe more worthwhile to do IVF, freeze embryos, take care of your uterus, fix it, and then proceed with pregnancy afterwards.
Yeah. Someone was trying to call me right now. Okay. Let's see here. The next question is, this is a good one. Hi, doc. My cycle length is 25 days. How many days after my period would my ovulation be around?
My cycle day is 25 days. How many days? So probably around day 10 or even earlier, 9. I would start checking ovulation kits if you wanted to, even as early as day 7 of your cycle.
Okay, here's a great one. Why isn't there more data on the efficacy of ERA testing? And if a patient is sensitive to progesterone, is there a benefit to do a mock cycle, or can you find yourself in a zero-sum sit? I'm not sure what that last part means, but I think basically, what do you tell patients about the data on the efficacy of the ERA test?
So I think newer data coming out is looking more promising, but the ERA test does have some controversial data that it doesn't make a difference in terms of live birth rates. I think anecdotally, most of us who have been utilizing it in our practice do see improved pregnancy rates. Mm-hmm. And of course, we want to do anything and everything to help offer our patients that option. One thing I will say, there's a concern about with ERAs that they are taking a sample of biopsy tissue from the uterus that assesses RNA, and RNA is not as stable potentially, and so maybe that is skewing some of the results. I think it's still coming out. I utilize it. I just counsel patients that I can't say that this is the end all be all perfect test, but there is definitely utility, and I see it improving outcomes.
Right. I mean, we had that fad of the endometrial scratch that was very fashionable. And so for me, I never, that wasn't a bandwagon that I joined, but I just felt like putting patients through the process of the medications, making sure they don't have an allergy to progesterone is always great before you actually have an embryo in your hand or in your uterus.
Yeah, that's true.
So
one thing I'll say about that, about if you have a progesterone sensitivity, you could always consider doing a natural cycle ERA as well, where you just let your body ovulate naturally and see how you do, and you can get a receptivity window from a natural cycle.
Absolutely. Yeah. And not all doctors have that type of flexibility like you and I do, but some do. So find that doctor. Okay. Here's another question. Let me go to this one. I just feel like when I'm saying things like pull out, maybe I shouldn't, if the question has that in there.
Okay. You can send me those later.
I'll send you those later. I'll definitely send you those later. Let's say here. Hello, doctors. Hi, honey. Do you know if there's any link between the level of progesterone on trigger day and successful embryo implantation?
Yes, if you're doing a fresh embryo transfer, there's very, very good data out there that if a progesterone level is greater than 1.5, you can have a reduction in pregnancy rate of even 20 to 30% or higher. So our goal when you are considering a fresh transfer is the progesterone level to be less than 1.5 on the day of trigger.
Perfect. Yeah, that's kind of what I tell patients too. I have hemorrhagic cysts, about 24 millimeters in size. Would these go away naturally? If so, how long would they take? Or is there any other option to make them go away? I'm cycle day 7. My progesterone is 2.7. So I know
Yeah.
what you're going to say because you're thinking exactly what I'm thinking.
Well, yes, they should go away on their own. It just is frustrating because that time limit can vary between people, but usually within a month or 3 months, it should go away. People will always offer birth control pills to help these go away, but the real answer is that birth control pills will probably suppress the production of another hemorrhagic cyst, but it doesn't necessarily, accelerate the resumption of that cyst. So
Right,
it's
right.
just frustrating. You have to wait it out, but most people it goes away on its own.
Yeah, and I would say specific because I can read the question and it's easier to see that. It says
Yeah.
since it's day 7 and there's a
Oh,
24 millimeter follicle and the progesterone is 2.7, it's probably ovulation, just like you said, it's gonna
yeah,
go
yeah.
away. Yeah, for sure. Okay, great question from Brooke. What about time to allow a patient to recover from progesterone after an ERA? Do you tell your patients that they need to allow time to recover?
From the progesterone?
Correct. Yeah, if they had bad side effects or maybe a reaction from the shot.
I mean, usually that goes away within a week at most, so it
Yeah.
shouldn't take too long.
Right, right. Yeah, I mean, some people are really sensitive to progesterone, but from a medical standpoint, there's no reason to have to recover. But from a mood and
No,
energy standpoint, some people just
right.
need a break from all those
Yes,
hormones.
absolutely.
Okay, so hi, doctors. Hi. Okay,
Hi.
what is a normal variation on AMH and blood test results? I noticed mine varied from 0.69 to 1.54 through 2019.
That's a great question. It can vary so much from lab to lab. Okay, so you have to see if it was done at the same lab. I personally like to check the AMH also at an early follicular time because there could be slight variations at different days of the cycle, even though that's a little controversial. But I think that that variation that you're seeing personally is probably within the realm of normal. I wouldn't necessarily assume your reserve went up. I would say that's probably stable, if anything.
Okay, great. Can you tell us if there are any ways to naturally boost estrogen? My levels went from 10 to 25, but still low.
Um, That's a hard one. Obviously, estrogen is made by maturing eggs. So if you have better quality eggs, hopefully, presumably, you're going to have better, higher estrogen levels. But that can vary month to month, and that's completely normal. Just again, everything you want to do to optimize your fertility and be healthy, diet, exercise, all of these, reducing toxins and other pollutants are always going to be helpful. So I would just do those things.
Great. And how much CoQ10, this is another question, do you recommend to take daily?
I usually tell people 200 milligrams 3 times a day. However, if you get the more active form called ubiquinol, then probably you could take 200 milligrams twice a day, and that'll be appropriate as well.
Do you have a particular brand that you recommend to your patients?
Thorne has a really good prenatal Jarrow, and I think it's Now brand. Now.
Okay. Okay.
What about you?
The brand I recommend, and there's so many, just like you
Yeah,
said,
Theralogics.
Theralogix is
Theralogics.
yeah,
Okay.
yeah, yeah. Okay. Is light cramping after frozen embryo transfer a good sign?
It can be. I mean, it could be implantation cramping, absolutely. It's so hard not to read into all of those symptoms that you have, but usually it can be a good sign. I definitely wouldn't sit there and worry that it's a bad sign.
Yeah,
Focus
I
on the
mean,
good. Be positive. It's a good sign.
it's hard. Yeah. Okay. So what are your thoughts on fertility acupuncture? I've had 2 failed IUIs. After all our testing, we have no known cause of infertility. We've been trying for 3 years.
So I think acupuncture is excellent. I think that it can absolutely help in circumstances, and I love to use it an adjunct to fertility treatments. So, and what I tell people is only do it if you find yourself going there and enjoying the experience. If you find it relaxing, this is your self-care, this is, time for yourself, then do it. Absolutely. But if you're doing it just because and you hate needles and it's torture and it's stressful getting there, then don't do it just to help you with your treatment cycle or fertility.
Right. Don't do it if you have to drive 2.5 hours to the acupuncturist.
Yeah.
Yeah, exactly. Okay. Hello, new follower from Minnesota. Hi, new follower from Minnesota. What do you feel are the best supplements to prime with pre-IVF? Any thoughts? And then the second question is this: any thoughts on foods to avoid?
Yeah, so absolutely, you want to take prenatal vitamins that have enough folic acid. I love to tell almost everyone to take coenzyme Q10 at the minimum. Vitamin C is good, especially right now as we're all boosting our immune system. And then in particular patients, there's other supplements that can be helpful. In women with very low or diminished ovarian reserve, DHEA can be a consideration. In addition, some women with PCOS, you can take myo-inositol. That can be helpful. There's information out there that prepping with a little bit of melatonin in the evenings can be helpful for pre-IVF. And then obviously diet is very important. The studies have shown a Mediterranean diet is best. Whole foods, less processed foods, less, sodas and sugars are all beneficial prior to IVF. And then what was the other one? Alcohol? Was that what it is?
Foods. And you answered it. Yeah. Like what supplements and foods? Perfect. And then someone asked us a very similar question, which is great. What other supplements do you recommend? And I think you answered that. The other thing that I usually tell people is, if you have endometriosis, sometimes adding N-acetylcysteine can be helpful.
Oh, yeah.
And there are other things that are part of my special sauce too. And sometimes I prime with HGH and not only use it in the cycle for women who, let's say, have a high FSH, have done previous failed cycles, or over 40. Okay. Hi. We got a greetings from somebody with lots of hearts. What are the chances of a 5AA versus 5BB embryo turning into baby? And also, you're both the best and we all love you. Thank you.
Oh,
okay, so 5AA and 5BB.
I think they both have a pretty good shot. Obviously, AA quality is always going to be better, so it has a slightly higher chances of success. So definitely, I think it's maybe on the order of about 10% higher. What would you say?
Okay. Yeah, I mean, I think that depending on the lab, I would say at least 70%, at least 70 to 85% for embryo, assuming that they have normal chromosomes. Cool. So we have someone saying hi to us from Sweden. Hi, Alexander from Sweden. Thanks for joining us. Okay, is getting pregnant naturally possible with diminished ovarian reserve and being over 40?
It is always possible. It is always possible. Again, it comes down to what are your goals. If that's your first pregnancy and your chance, you can, consider you have diminished ovarian reserve, you're 40, consider doing fertility treatments to freeze embryos to have the opportunity for multiple children. But if you are just trying and you have proven fertility previously, you have diminished ovarian reserve, I think it's appropriate to try for 3 to 6 months, and you can absolutely get pregnant naturally.
Great. So here's another question. Do you recommend HGH to all patients, or is there a specific marker and blood results which guide you to this suggestion?
To be honest, I don't use HGH that much. Where I trained, we really didn't use it often, but I will use it in patients who have had a failed prior IVF cycle. And I really do think that, there could be a benefit to help their embryo quality or their response, or like you said, in certain people, it helps with priming prior to the IVF cycle. But in general, I use HGH in probably less than 10% of my patients. Yeah, but that varies from REI to REI. So.
Absolutely. I mean, I'm comfortable using it more because I've been using it since 2008. Okay. And then I noticed when I had patients, especially patients over 40, I was getting them pregnant or getting them a normal embryo after like 3 cycles. And I'm like, I've done the same thing. Like, I don't understand why it's working now. And then it took me too long. I wish I figured this out sooner than later. I was like, yeah, what was different was that, at that 3rd cycle, they'd been on HGH for 2 months, Yeah. So I feel like there might be a cumulative benefit, and Absolutely. I don't know why it helps in some patients and not in others. I wish we knew. Okay, so my partner's semen analysis is good. What male supplements do you recommend and dose? So what is your special sperm sauce?
If the semen analysis is good, I think a multivitamin, taking a multivitamin that has vitamin C is great, and adding on potentially a CoQ10 a day and a fish oil supplement or omega-3. That's probably what I would suggest. Now, if there is more concerning findings on that semen analysis, there are some other fertility boosting, motility boosting supplements available that I'll recommend. I don't have one particular brand that I go to, but there are different ones on the market, and they're all pretty close and equivalent.
Yeah, so there's the Theralogix brand. That's one that I actually stock. And then Alpha Sperm, alphasperm.com. That's another one. And the makers of that just gave me a code for anyone who's listening. It's Egg Whisper 550, and it's 50% off. And all proceeds
That's
come to me.
huge.
I'm kidding. No proceeds come to me, but they should. I should.
They
let them
really
know.
should.
They really should. I know. Seriously. Okay. Here's a great one. Sorry if I missed this, but are there any PCOS specific supplements that you recommend?
Yeah.
And then there's a part 2 to that question, but I'll let you answer what your PCOS special blend is, and I'll share mine too.
I love myo-inositol. I feel like it does a lot of wonders for patients with PCOS, so that's what I would suggest. And then obviously I really talk beyond supplements. It's all about like diet optimization of lifestyle, exercise. Those kinds of things are really important.
That was the part 2 of the question. You kind of just answered it. So my special sauce for PCOS are very similar: myo-inositol, NAC, lipoic acid, CoQ10. And then basically, you know, as far as weight loss, so the second part of the question, does weight loss significantly improve your chances of successful FET if you have PCOS? I'll let you answer that question.
For FET, I mean, it's weight loss absolutely will be helpful, and it'll help you have a healthier pregnancy coming forward, but you have to consider your timing of what you're doing. I don't necessarily like people to go on extreme keto diets right before their embryo transfer cycle. So if you're prepping for it in about 3 months, then absolutely any weight loss and lifestyle modifications that you can keep permanently throughout the pregnancy and in terms of healthy diet and exercise are going to be very helpful for you.
Great. So I'm going to ask a whole bunch of questions fast because
Wow.
I know we don't have that much time with you because you're super busy, but we just got a whole bunch of more questions. Here we go. I usually get multiple positive OPKs, sometimes for an entire week before I peak. That sounds like it should be a song. An entire week before I peak. Is that bad?
No, it can happen to some people. There's some papers out there that actually show some elevated LH levels, and people can have kind of a double peak of their LH surge. But the fact that that's happening can be normal, and it can be fine. If you ever wanted information, you can always be monitored by a fertility doctor and have your follicles actually evaluated and monitored. You can see the growth of the follicles and correlate that with the actual peak and see if it really matches up and lines up and you are ovulating, but it's not necessarily a bad thing.
Okay. This question I've gotten before. I'm curious what you will say. So what's your thoughts on transferring 2 embryos? My doctor said if transferring 2 different quality embryos, if you have a bad one and the bad one will drag the good one down. What do you think?
There's been information and studies that have indicated concern about that. But usually, you know, if somebody has 2 borderline quality embryos, and depending on their age, if they're, you know, definitely over 40 and it's not been genetically tested, I will proceed with allowing transfer of 2 embryos. I usually follow ASRM or the American Society of Reproductive Medicine's, you know, guidelines and recommendations. I don't believe necessarily that, you know, the few studies out there that state that if there's a poor quality embryo, it's going to take down or not allow the good quality to implant.
Yeah. Okay. What do you do, or how do you prepare a patient for a successful FET?
Okay, well, the first thing I do is make sure all of their labs are optimized. I don't want to start someone who has a thyroid test that's out of normal, and make sure all their labs are good, they're not anemic, all of these things, because they're almost going to be pregnant. So that's number 1. Number 2, I want to make sure that their uterine cavity is pristine. It is where the baby is going to grow and implant and everything related to that pregnancy. So a uterine cavity evaluation is very, very important. And I want to make sure that they're also doing the transfer at a time in their life where it is appropriate. It's not a stressful time with work or some other circumstance. And those factors are really important to me in prepping them. And obviously diet, supplement, vitamins, and all those great things.
Awesome. So we have 3 supplement questions. here we go. What do you recommend for patients who have endometriosis from a supplement standpoint?
Yeah, so I think you touched on it, and I'll mention again. I like them to all be on coenzyme Q10. In addition, N-acetylcysteine is very beneficial. It is a very strong antioxidant, and endometriosis is an inflammatory condition, so it can be helpful. There's information that our lipoic acid is also helpful too. So in considering how people respond, I will discuss those supplements, and then consider dietary factors and non-inflammatory diets like reducing dairy, red meat, gluten. Those kinds of things can be also beneficial in addition to supplements.
Perfect. And do you recommend inositol for patients with, let's say, poor responders or DOR patients?
On occasion, it's not my first go-to thing, but on occasion.
Yeah, I saw a really beautiful Japanese study showing how melatonin and inositol can potentiate each other's effects and might help with egg quality. So sometimes I do.
Yeah.
Okay, so here's another question. What supplements do you recommend for low egg count?
Yes, so definitely coenzyme Q10. And then depending on the patient, I usually will have them start DHEA, 25 milligrams 3 times a day. But I do it in caution because some people just take DHEA and they don't have their levels checked, or they're on it for 9 months and then their levels are through the roof, and that's not going to be helpful. So you have to use DHEA with a little bit more caution.
Right. You're growing a mustache and have acne and have a deepening of your voice. It's time to stop it. Okay. Have you ever seen a 44-year-old get pregnant through IUI or spontaneous pregnancy with an AMH of 0.13?
0.13. I've definitely seen a 44-year-old get pregnant, and I think their AMH was very low. Unfortunately, they miscarried, but I always give this example. I don't know what AMH was, but it's always possible. My grandmother had my uncle when she was 48, so there's always possibilities out there. Unfortunately, a lot of these pregnancies, more than 50% will result in a miscarriage, but it's always possible.
It is always possible. We all have those stories. Is it okay to continue CoQ10 when pregnant?
Yeah, there's some information that it could potentially be helpful with women who have recurrent pregnancy loss. I would always talk to your OB provider, and I definitely don't think I would be on as high of a dose, but about 200 milligrams once a day should be fine.
Yeah. Other than a prenatal, should women, we're getting so many good questions.
Supplements.
Okay. I know. Other than prenatal, should women with regular cycles take any supplements? I'm scared to mess with my cycle.
Take other supplements besides prenatals?
Yeah.
I mean, if you're trying and you have been trying for a while, I don't think it's bad to add on coenzyme Q10, even if you have normal ovarian reserve. So to me, that's okay. If you want to consider taking other supplements like adding on folate, that's probably okay as well. Vitamin D, I love vitamin D, and I think most of us are vitamin D insufficient or deficient. You can get your levels checked, or you can take about 2,000 of vitamin D a day as well.
Right. Prenatal, fish oil, CoQ10, vitamin D, and you're solid. You're golden. Your eggs will be golden. Okay. So how many times should we take CoQ10? I think that's the dose question that you said. Why don't you share your special dose recommendation?
I usually do 200 milligrams 3 times a day. If you're taking the more active for ubiquinol, I say 200 twice a day, but there's variation.
Yeah. I mean, take what you can tolerate. Not everyone can take that pill and not have an upset stomach. Okay.
Wow, that was fun.
That was a blast. Well, thank you guys. Fire. I know, seriously. Well, thank you everyone for sending in your questions and emailing them, chatting me, DMing me, and posting them live in this chat. Okay, I'm going to take one last question from Sweden because she's here from Sweden. Okay, 2 more questions and then we're done. And then we're going to sign off. Okay. Can an ugly embryo turn into a normal baby?
Of course it can.
I know.
It can.
Okay, good. And then the other one is, would you recommend IUI or IVF when you have a low egg count?
It's so hard. I really would recommend IVF because we know the chances of success are higher and your egg count is low. Your opportunities are fewer. You want to do what's most successful for you.
And you can always do IUI if IVF doesn't work.
Of course.
Right? It's not going away as an option.
No, absolutely not.
Yeah. Okay. Well, thank you, Benna. It was really nice to have you on. I hope to see you again. Thank you, everyone, for joining us, and hopefully we'll see everyone soon.
Yes.
Bye-bye. Have a great night.
Bye.
Take care. Bye-bye.